Hello, I'm Lotte Hansen. I'm a chiropractor and certified DNS practitioner. I'm going to show first an exercise we give for helping people breathe better. So I have two that I normally give people. So the first one is lying on your back with your palms facing up and your shoulders relaxed. And you try to get your shoulders to the lowest comfortable position you can get to. I put a towel under the head, so try when you do it to not put a floppy pillow underneath. A towel, or if you need to elevate a bit more, maybe a TheraPad, a high density foam pad. For this patient, I choose to put a ball underneath the knees. So if you lift your knees up there, so we get 90-degree flexion in the hip. The knees are slightly more apart than the feet, so the knees line up with the hips, and then we want the ankles in about 90 degrees flexion, but don't pull the toes back. So maybe just a light grasp on the feet, not too much, so minimum tension. The hands, the fingers are spreading out like you're holding a big rock, and I'm just going to pull this up here. Yeah. So with the breathing, what we want is we want the activity here. So the goal is to not lift up the chest, and you breathe through your nose. See how the person is tensing up the neck here. So we want Leanne to relax a little bit more, gently tuck the chin in and put the shoulders down, and relax the jaw. And then here we want the chest in the lowest position they can get to. And don't worry if you don't get it perfect straight away. It takes a bit of practice. So we want the breath to come down as deep as possible. And remember, when you breathe deeper, you don't need to breathe as often. So if you breathe deep and frequently, you tend to get tingling in your hands. So don't want that. So if you do find you get that, you need to breathe slower. So I generally tell people breathe in for 4 seconds and out for 4 seconds. And it's not pushing or pulling anything. It just feels like a natural expansion. We're not forcing it. Sometimes people find it's really hard to breathe into here. They feel they can't feel what's happening. And I generally tell people to put their hand on, probably better to put it on the skin, straight on the skin, and your brain can feel where it is you want the breath to go. So you tell your brain that you want to fill up your palms with air, and then naturally you can feel your hands lifting up a little bit, and that gives the brain a cue. And then maybe after a minute or two of doing that, and you feel you got the hang of it, then you can put your hands back by the side again and keep going. So that's the breathing on the back, and continue the exercise if you can for about 5 minutes.